Good evening. My name is Dr. Singh, and today I shall be talking to you about one of the common problems of day to day life, that is, major depression. We all undergo happiness and sadness during our day to day life, and that affects our mood. Now, these mood changes are basically the result of our response to the things which happen to us or to those who are around us, whom we love, whom we like to be with. But the problem with depression is that we can't afford to leave a patient out just because we could not diagnose it. And on the other hand, we can't misdiagnose someone and take a person for a major depression when actually he is not. What would happen in that case? That he would be left with a kind of psychological trauma of having got a psychiatric problem, and of course, he has to undergo prolonged treatment for it. To avoid this confusion, the Diagnostic and Statistical Manual that is there in USA, the one which sets up the criteria for diagnosing a psychiatric illness, they have fixed up certain criteria. So if a patient comes in that criteria, he is called a case of major depression. Now, it's important for us to know that all the criteria have to be there for at least 2 weeks at a stretch for a person to be diagnosed as a case of major depression. For example, if a person could not get a cell phone of his choice during this Black Friday sale and he is sad for 2 days, no, he cannot be a case of major depression. Now, what are the criteria? We have to have at least 5 of those for at least 2 weeks continuously to diagnose a patient as a case of major depression. The first criteria is sadness. A patient with major depression is sad for most of the time on most of the days. Usually, there is no major reason. You can't really decipher as to why he is so sad, but the person doesn't come out of it for weeks on end. The second criteria is anhedonia. Now, what is anhedonia? It's a condition in which a patient is unable to be happy in circumstances under which anybody else would be happy. For example, if you are given a day off unexpectedly, all of you would be happy. But a person who's got major depression and is suffering from anhedonia, he may complain of having lost the airfare or the rail fare for that day. He just finds a reason to be unhappy. So anhedonia, if it is present, it's a great pointer towards major depressive illness. Another reason or another criterion for diagnosis of major depressive disease is change in the sleep pattern. You would be surprised to know that a person with major depression could be sleeping most of the time, or he could be tossing about in the bed most of the time, trying to go to sleep. So it can be either way. A person who is too sleepy without any reason, or a person who does not get to sleep despite his best efforts. Another criteria which we have to keep in mind for diagnosing a person with major depression is change in the food habits and change in weight. You must have heard some people, they are depressed and they keep eating all the time and they gain weight. Or there are others who lose their appetite completely and they start losing weight. Now, the important thing is that the loss of weight is without any specific effort on the part of the patient. There are people who are obese who want to lose weight and they would try anything, but in this case, a case of major depression, there is no effort on the part of the patient, but they start losing weight and they do not eat. In addition to this, there could be a person who has got suicide ideation, or there may be attempt to commit suicide, or there may be a feeling of worthlessness or unnecessary guilt. You can be having guilt if you have done anything wrong, but a person with major depression would not have done anything and still be feeling guilty about it. Now, Who are the people who are likely to go into depression? Now, it has been seen that women are more likely than men to go into depression. Almost 3 times women go into depression versus the male of the type. The reason for it has been kind of attributed to major changes in their hormonal level during the pregnancy, during lactation, or during the menopause. There could be any other reason also. Another important thing which goes in favor of going in for depression is the genetic history. People who have got patients of depression in their family, they have got almost 3 times more chance of going in for depression. Now, people who have got major diseases, what we call as the medical comorbidities, people with major comorbidities are more than others likely to go in for depression. For example, people who have got cancer, people who have got HIV/AIDS, or people who have undergone major trauma, they are likely to have more chance of going in for major depression. Now, I have covered the diagnostic features and the um, chances of getting depression in various kinds of people. If you have any doubts, please let me know. Any questions? Thank you.